Chronic kidney disease is defined as a permanent partial loss of kidney function. It's a slowly progressive condition that affects the kidney's ability to function effectively. In some countries, such as Sri Lanka, it's quite prevalent in dry zones. And because of this, and because it's such a huge problem affecting nearly 10% of the population, I decided that during my Christmas holidays I'd fly out there to see what more I could learn about this and to see what more I could do to help.
Chasing visions of our futures. One day we'll reveal the truth.
Sri Lanka historically is an agricultural country, but we don't have the history of having such a disease, and this is a new phenomenon. And what I see is this is remarkably visible in areas where agriculture was first started using fertilizer. This shows there is a connection between use of fertilizer and the problem.
We've just come with a farmer friend of mine, and what he's done is he's promised to take us out into his paddy field. And while we were here, we had a walk around and a look around through the fields, and what we found is little bottles of poison and stuff that people have just left lying there.
There's a history cited here. In Japan, there's a thing called itai. That means they got some kind of a problem where they get severe pain in the body. And then when they studied the factors, they found the people who are using a particular river for their consumption and use their water, they were suffering from this. So that river was cadmium poisoned, right? So similarly, even in Sri Lankan water, you have now certain percentage of cadmium presence. And cadmium presence comes because of surface runoff from the rainwater minerals, and then it goes to the river. There is a major environmental reason why this is happening. When they use fertilizer, what happens is fertilizer goes to the ground, water, rainwater, it percolates down to the soil, and then it merges with the groundwater. So that is how I see this. And also we can see it is the farmers and mainly males who are mostly the males are impacted. If you take in the village agriculture, particularly paddy farmers, it is the men who work in the field, but fundamentally the men spend most of their time in the farm. So one is they are exposed to this organic fertilizer by breathing, because certain thing can be airborne and polluting the air. Then by touch, because they have sprayed it on the ground and they tread and walk in that. It is wet in the wet formation. Then if they have pores in their bodies, small wounds and things also, things can enter the system. Third, they are drinking water from the field. There will be a well in the field. So from all these sources, this can pollute.
I came here with a bottle of purified water, but unfortunately for people around this area, they don't have this luxury, so they drink from rivers and lakes like the one behind me. And as you can see, farmers actually wash their machinery in these rivers and lakes, and unfortunately this is the only source of water people here have. This is a dry zone in Sri Lanka, and the water that they have is literally all they've got, and that's what they've got available to them, these little rivers and streams that flow through the fields. And therefore this is what they use to drink, to cook with, and to clean their clothes. And when farmers wash their machinery and all their sprays and pumps in these river systems, it leaks into them and causes all these problems. After a long day in the field, we interviewed the farmer to find out what more he knew about this disease. I've noticed that you've been around in your fields without any type of protective equipment. Do you have any kind of awareness about this? Has anyone told you whether you should wear protective masks?
நாங்கள் அதை பற்றி எதுவும் யோசிக்கவும் இல்லை, அதை பாவிக்கிறதும் இல்லை. முதலாவது நாங்கள் ஆரம்பத்திலிருந்து புல்லுக்கு எண்ணெய் அடிக்கிறது, அதுக்கும் அதே உடையான் போடுறது, பயலை எறிகிறது, அதுக்கும் அதே உடையான். அதில் எங்களுக்கு எந்த விதமான பாதிப்பும் எங்களுக்கு ஏற்பட்டது இல்லை இதுவரையில்.
Have you been told that by not wearing masks and using like pesticides and stuff that there's actually some really bad health risks that could help damage your health?
எங்களுக்கு தெரியும், அது அரசாங்கத்தால் வைத்தியர்மாரும் சொல்லுவாங்க, எல்லாரும் சொல்கிறாங்க. ஆனால் எங்களோட தொழில் அது நாங்கள் அப்படி தான் செய்ய வேணும். அப்படி செய்தால் தான் எங்களுக்கு அதில் வருமானம் எடுக்க முடியும். அதனால் நாங்கள் அப்படி தான் செய்கிறோம்.
I just want to show that through doing these interviews and coming out here, we're actually raising more awareness about this disease. Because just as I've been doing this interview, a small crowd has gathered. These are farmers, because this is like a small restaurant in the middle of the field. So these farmers actually, by me doing this, we're actually raising awareness of how to stop dangerous chemicals getting into your body. Have you heard by doing this work in the fields that it could actually lead to a higher risk of chronic kidney disease?
நாங்கள் அறிஞ்சிருக்கிறோம், அரசாங்கமும் அறிஞ்சிருக்கு, டாக்டர்மாரும் சொல்லியிருக்கிறாங்க. ஆனால் நாங்கள் ஒன்றும் செய்ய முடியாது. நாங்கள் இதை செய்தால் தான் எங்களோட தொழிலை பேச முடியும். மற்றும்படி அறிவிச்சிருக்காங்க, டாக்டர்மார் சொல்கிறாங்க, வைத்தியர்மார் சொல்கிறாங்க, சகலரும் சொல்கிறாங்க. நாங்கள் காணல, எங்களுக்கு அது வரையும் இல்லை. அதனால் நாங்கள் அதை செய்து கொண்டு இருக்கிறோம்.
The conditions that the people here live and work in aren't the best, and it's clear from this interview that more needs to be done to educate them about the disease and the measures they can take to prevent it. I then travelled to Kandy, where I met with Dr. Wazil, a consultant nephrologist at the General Hospital there. In his following interview, he shed some light on the treatment that's available to patients and what's being done to prevent the spread of this disease.
In early stages, basically they are asymptomatic. They don't have any symptoms, and it is detected on screening programs. That is doing some urine and blood tests. Urine for microscopy, and the blood we do serum creatinine, and also doing an ultrasound scan of the kidneys. Basically these three tests we detect the chronic kidney disease of those are the early stages.
And are these tests done regularly, or are they just for other diseases that they're screened for?
Now, in the CKD of known causes, that is diabetes, hypertension, and general recommendation, they are every year they have to undergo these tests. But the problem is the CKD of unknown etiology. They don't have any illness that could cause kidney disease. So, because the number of patients who are coming from certain geographical locations, the government of Sri Lanka, the Ministry of Health, has initiated the CKD screening programs, where the doctors and the paramedical staff go to their villages, and the people are called for testing, and then those who are found to have a positive results are again those tests are repeated and confirmed, and once they are confirmed to have certain indications of the CKD or CKDu, then they are further evaluated with a kidney biopsy and further testing, and also exposure to unnecessary drugs, because most of these farmers developed aches and pains, and they take over-the-counter medication for painkillers. So those medications are further harm the kidney. So and we educate them to avoid those medicines. And despite all these measures, proportion of patients reach end stage, and they are provided with dialysis or dialysis followed by transplantation.
What more could be done? Like, what research could be done to solve this issue, and what more can be done by the people themselves to help?
from the research point of view, the research need to be continued to find the exact cause. Then that cause can be avoided.
The sociological problem that this is now creating is, particularly in the family life, children's mind and their behavior, because they are living with insecurity. They don't know when you will come to know that my father is suffering from this, mother is suffering from this. Basically, in these areas, North Central Province, now it has even gone to Southern Province. In the North Central Province, it is said that at least every family has an individual who is suffering from this. So that is a major thing, and this is a major social impact. And when this sort of physically influenced environmental condition affecting the social situation leads to frustration, and compounded with that, poverty and joblessness and other factors, family feuds leads also to high level of suicide. So it's not a linear problem, it is a web. It connects from various sides and harms the people. So purely by psychosocial support we can't answer. We have to remove the physical problem whilst giving psychosocial support.
I wanted to find out more about the effect that CKD had on families and young children, so I met with the director of a children's hospital in Colombo, who could tell me more about the effect of CKD on young children. And if the children get these type of diseases, what effect does it have on their families and stuff?
So if they get kidney disease, and if they are to transplant kidney, that is huge problem, disaster for that family. We are yet to start the kidney transplant program in the government sector for children, and we never continuously dialyze patient. If we know that we cannot do the transplant here, and they cannot afford, and then we counsel the family and explain them and take a kind of a mutual kind of a decision about the management with the family and the team of doctors, and then we act accordingly.
So what more is the government doing to prevent this?
Yeah, the present government is more keen about this problem, and the media involved and the researchers involved. Now the government as the pioneer provider of healthcare, now we have taken so many steps. Government self have a national program for preventing unknown etiology kidney problems, and some policy decisions were taken in the recent past, such as banning some agrochemicals, something like that, and the screening program started, and the kidney hospital is coming as a donation from China to Polonnaruwa, some faraway place from Colombo. Likewise, we have accelerated our actions for this disease.
Lifestyle change and change in the means of production are major factors that can answer this, right? One is lifestyle change of the people, and the farming method have to be productive, but it has to go back to more environmentally conducive, less harmful and sustainable means of using. So air pollution, water pollution, soil pollution, and then the food that we eat is polluted. So all these will, is creating a web of sicknesses, and the strains from where it is starting will always be unknown unless we look at it in a holistic way.
So as part of an international community, what more can other people do to help?
Yeah, that's a very good question. We can improve anything, we can, up to some extent. We need not only money, we need knowledge. And when it comes to this kind of kidney disease, the correct cause is unknown. So the international community, with sophisticated knowledge and facilities for research and development, and if they can support us, we can. We have the manpower. We have the manpower, and we need the support technologically. We need a lot to do, and the international community can come up for help.